So my study is about the evaluation of efficacy and safety of an immunotherapy regimen in solid tumors selected based on the presence of tertiary lymphoid structures. So this phase 2 study is a histology agnostic study in which we can enroll the patient whatever the tumor types, but the common point of this patient is to have tertiary lymphoid structures in the tumor samples, because we have previously reported and published that presence of tertiary lymphoid structures is a very strong predictor of immunotherapy efficacy in cancer patients. So this is a phase 2 study investigating the combination of an anti-angiogenic agent, regorafenib, in combination with a PD-L1 inhibitor, Avelumab, in solid tumors selected based on the presence of tertiary lymphoid structures. So the identification of tertiary lymphoid structures was based on central review. This study was performed across 6 cancer centers in France. And the patient had very different tumor types, including digestive cancer, gynecological cancer, thoracic cancer, sarcoma, etc. Again, the common point in this study is that they all have tertiary lymphoid structures in the tumor samples. The first objective was the objective response rate, and secondary objectives included progression-free survival, overall survival, and also translational analysis of the tissue samples and of the plasma samples that were collected at baseline and during treatment. So the results were actually very encouraging. We observed that a majority of patients had tumor shrinkage. The study reached its first objective endpoint, and basically we observed objective response even in histological subtypes that are actually considered as resistant to immunotherapy, such as, for instance, MSS, colorectal cancer, biliary tract cancer, and ovarian cancer. So the efficacy results observed in this study suggest that even in this indication, usually considered as resistant to immunotherapy, if we select the patient with the right biomarker, and here is the presence of tertiary lymphoid structures, we are able to identify the patient who can get some benefit of immunotherapy. So this study is actually the first agnostic study using a TLS as a biomarker to select patients for immunotherapy. The positive results observed in this study confirm a previous study that we reported in 2022 in Nature Medicine, which showed that when we select sarcoma patients based on the presence of TLS, we can observe significant clinical benefit of immunotherapy. Here we have the demonstration that the TLS are also useful to select patients in other histological subtypes besides sarcoma. So the impact for future research is to clearly use TLS in selected tumor types to develop chemotherapy-free regimen in this group of patients. And for instance, we will launch very soon a new study in non-small cell lung cancer in the first-line setting using TLS to select the patients who are more likely to benefit from a chemo-free regimen in the first-line setting.